Good, happy Tuesday morning, January 5th, 2021. I'm Riley King, and welcome to the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this Tuesday morning, so let's begin. First up, we begin with COVID-19 updates. 879 new cases of COVID-19, 10.5% positivity rate announced by health officials. One more death announced. Let's take a listen to that video from WNUR News 9.
Here at Gunstock Mountain Resort, we are excited to share a healthy and fun 2021 season with you. Know before you go and visit gunstock.com to buy tickets and for the latest info. We can't wait to create memories with you and yours all winter long.
Tonight, hospitalization numbers are 319, 879 new positive tests, bringing the total number of confirmed cases to over 47,000. That's 3.5% of New Hampshire's population. 6,200 are current cases. 781 Granite Staters have died from COVID-19.
Okay, and there you go on that video and that report. And now let's take a look at COVID-19 in New Hampshire. New information, data, maps, and graphs. So let's take a look at that information right now. And here is a look at that information for all of you right now. There are 47,328 number of people in New Hampshire have tested positive for COVID-19. 20,782,635 number of people in the United States have tested positive. 781 number of deaths from COVID-19 in New Hampshire. 916 number of people have been hospitalized with COVID-19 in New Hampshire. And 353,069 number of deaths from COVID-19 in the United States. Let's take a look at this map of New Hampshire where current cases of COVID-19 are. Concord, 306 current cases of COVID-19. Let's take a look at this map of New Hampshire where total cases of COVID-19 are. Concord, 1,793 total cases of COVID-19. And now let's take a look at these three charts here. Let's start with the first chart here. New cases each day in New Hampshire in the purple. Daily new positive COVID-19 cases. Orange, new hospitalization. And red, deaths. Let's take a look at this chart here. Current cases in the purple. Total current COVID-19 cases. Orange, current hospitalization. Let's take a look at this chart here. Total cases in the purple. Total positive COVID-19 cases. Orange, total hospitalization. Red, deaths, and blue recovered. Let's take a look at this chart here. Positive PCR test rate, positive PCR and antigen test rate, and daily PCR test. And let's take a look at this chart here. Age group of cases, and female and male of cases. Let's take a look at this chart here. Infections, hospitalizations, and deaths. Let's take a look at this chart here. Deaths, percent of New Hampshire population, rate/ethnicity of cases, and hospitalizations. And a reminder, your common symptoms: fever, lack of smell, cough, chills, difficult breathing, nausea, vomiting, and diarrhea. How it spreads, and prevention tips. And be sure to stay with the Riley King Network for the latest of your COVID-19 information. New Hampshire lagging in COVID-19 vaccines, altercated, administered, compared to New England in CDC data. Governor says supply is part of the challenge. Let's take a listen to that video from WMUR News 9.
With all that's changed over the last year, consider COVID-19 testing from Quest, trusted by millions of people like you. Order online. Select from drive-through.
According to the CDC, New Hampshire is slightly behind Vermont and Maine in terms of COVID-19 doses administered per 100,000 people. But it is also receiving fewer doses per 100,000 than those states. Governor Chris Sununu says it comes down to supply.
I think the reliability of the federal system is there. We're simply not getting as much as we would like. So what we originally anticipated getting, we're not getting.
The governor says most shots right now are going to long-term care facilities under a federal plan being carried out by national pharmacies.
The CVS Walgreens model in how they administer the vaccine to our long-term care facility has been bumpy. We stay right on them almost on a daily basis. So anytime there are issues there, we talk with them, we work it out. The good news is that the schedule that they originally committed to us, they are still going to meet.
The demand for more vaccines comes during a time when there's also a demand for more tests. State health officials say testing increased around Thanksgiving and has remained steady.
Generally, the average turnaround time for when somebody gets their specimen collected to when they get the test result back is around 2 days right now.
But hard-hit areas may have to prioritize those with symptoms.
There's going to be priority given to staff, to students who might have symptoms of COVID-19 and need more rapid turnaround time in their test results in order to be allowed back into school, for example, or be allowed back to work.
Now, the governor says if vaccinations stay on track, he expects to see noticeable progress by the end of February, adding hospitalization rates and fatalities may even start to subside. Reporting live tonight, I'm Tim Callery, WMUR News 9.
Okay, and there you go on that video and that report. DHHS state health care system has not reached capacity. Hospital consensus consistently shifting. Officials say surge units would come before flex sites. Let's take a listen to that video from WMUR News 9, Amy Cavino.
In uncertain times, it's okay to feel worried.
Or lonely. You're not alone. Even while you're at home, we can help. Riverbend Community Mental Health. We're here for you. Take time to be kind to your mind.
We're tight.
The census changes hour by hour. The ICU at Elliott Hospital hit capacity this weekend, so officials say they utilized their on-site surge unit for 2 patients and transferred 2 others to other hospitals. Only half have coronavirus.
There are also patients who are not COVID who need our care. Holding off on illness is not always a good thing either.
The Elliott also received patients from CMC. The collaboration is ongoing. The ebb and flow, continuous. Tiring? Yes. But officials say it's working.
I could not be more proud of our hospitals and the work that they're doing, the collaborative spirit in which they have, worked over the last several weeks.
The hospitals meet every single day and have been for months. Christmas and New Year's Day, no exception. Anand says it's that level of communication that has kept the need for flex sites at bay.
We are unique in the sense that, we're a small state. We all know one another. We all work together.
The messaging has not changed. Wear a mask. Stay home. Wash your hands.
It's hard to fathom that people don't believe in masks and social distancing, and that there are so many community activities that may still be happening.
DHHS released a statement to News 9 about flex sites. It says in part the state's healthcare system has not reached capacity and that surge sites within hospitals would be used first before moving to those flex sites. We're live this evening. Amy Cavino, WMUR News 9.
Okay, and there you go on that video and that report. Several New Hampshire hospitals now offering monoclonal antibodies to combat COVID-19, available only to certain patients. Let's take a listen to that video from WMUR News 9, Kristen Carosa.
All that's changed over the last year, consider COVID-19 testing from Quest, trusted by millions of people like you. Order online.
Monoclonal antibodies are now being offered at Portsmouth Regional Hospital, Frisbee Memorial Hospital, and Parkland Medical Center.
The way they work with the COVID virus is they surround the virus and they stop the virus potentially from getting into the cells. So it blocks the virus during a critical phase, and there's always that chance that the virus will progress regardless of what we do. The only true definitive therapy that we have is vaccination.
Dr. Thomas Wold says the one-dose outpatient IV treatment is for people who have mild to moderate symptoms and are at risk for hospitalization. He says people should inquire about this therapy through their primary care physician within 10 days of contracting the virus.
It has shown to be a benefit for patients who are in the right risk groups, who are sick with COVID. And by giving the therapy, it reduces their chance of getting sicker. And very important for us, it reduces their chance for hospitalization.
Long-term care facilities also have the option to offer this antibody therapy to its residents.
We're going to take advantage of every option that's available to us. They get it through the state, and they'd probably partner with a pharmacy in order to be able to handle the infusions. That's something that the average facility itself might not be able to handle.
But the CEO of the Healthcare Association in New Hampshire says their primary focus is to make sure people don't contract the virus in the first place.
It's another tool in our toolkit in combating this virus. Really, though, the ultimate answer for us is just to speed up the pace of vaccinations. And the quicker we get people vaccinated, the risk of COVID-19 goes away.
Kristen Carosa, WMUR News 9.
Okay, and there you go on that video and that report. New internet data plan by Comcast Xfinity could lead to extra fees for subscribers. Let's take a listen to that video from WMUR News 9, Mike Cherry.
Break free from 2020 and get moving at Planet Fitness in our clean and spacious clubs. And use our crowd meter for the best time to visit. Join now for no enrollment, $10 a month, no commitment. Deal ends January 7th.
Whether you're Zooming business calls from home or your kids are learning remotely, soaking up internet data is easy to do these days. Starting January 1st, Comcast Xfinity began phasing New Hampshire subscribers into a data cap plan, charging any customer who goes over 1.2 terabytes per month an extra fee. But according to an IT specialist in Bedford, don't panic just yet.
Assuming Comcast is going to cap at 1.2 terabyte, for regular email, browsing, shopping online and stuff, it's more than enough.
According to Comcast, the median subscriber used 308 gigabytes per month in 2020, with only 5% of Xfinity users going over the new 1.2 terabyte cap. In a statement, Comcast says in summary that those super users generate the greatest demand for network development. Comcast offers an unlimited data plan for $11 more a month.
So on an average, a Zoom call which is on HD quality would be about consuming about 2.5 gigs per hour. That would give you about 400 hours of Zoom calls in the entire month.
Ash believes video gamers will be most impacted. As for anyone streaming movies,
an HD movie typically is about 2 gigs. It could be a little bit more, a little bit less, but on an average, let's say it's 2 gigs, which means about 500 movies you can download in a month. So that's a lot of movies, and that would probably not affect most people.
Comcast says it is providing a 3-month grace period. Anyone who goes over 1.2 terabytes won't see a charge until April. Mike Cherry, WMUR News.
Okay, and there you go on that video and that report. State health officials monitoring testing for variant COVID-19 strains. Officials say new strains likely to be seen in New Hampshire. Let's take a listen to that video from WMUR News 9.
Changed over the last year. Consider COVID-19 testing from Quest, trusted by millions of people like you. Order online. Select from drive-through.
Well, state health officials say so far they have not found any new variants of COVID-19 here in New Hampshire, but they say it is possible. State epidemiologist Dr. Benjamin Chan says viruses go through changes or genetic mutations as they spread from person to person, similar to how the flu changes every year. A new strain of COVID-19 was recently discovered in South Africa. That is different from the other variant that has popped up in the United Kingdom as well as a few states right here in the U.S. Dr. Chan says it's likely we will see a new strain of COVID-19 here in New Hampshire. He says the Granite State is working with the CDC to try to do more genetic testing on specimens that are positive for COVID-19 to really take a closer look at the makeup of the virus.
There's no evidence that these new strains cause more serious disease. There's no evidence that these new strains are more likely to cause somebody to die from COVID-19. There's no evidence that these new strains that the vaccines are less effective against these new strains. That's obviously still being studied.
And Dr. Chan says what is concerning about these variants is that they appear to be more contagious, and higher levels of transmission can lead to more hospitalizations, adding to the burden that local hospitals are already experiencing. Reporting live tonight, I'm Tim Callery, WMUR News 9.
Okay, and there you go on that video and that report. Manchester Mayor proposing hiring Director of Homelessness. Proposal goes to a committee today. Let's take a listen to that video from WMUR News 9, Nicole Lally.
Irving Energy now offers easy online ordering for local home heating oil deliveries here in New Hampshire.
It's what other communities our size have done in the past, and I think it's something that we need to try and work out.
Manchester Mayor Joyce Craig is optimistic the city will soon have a leader to coordinate and manage its homeless community.
It's important that the city of Manchester, they felt it was important, as do I, that the city have a director level to address homelessness in the community.
Caring for and managing the homeless in Manchester has been a hot-button issue the past few months. Back in November, a homeless encampment behind the courthouse was dismantled. Weeks later, a new temporary shelter was opened up at the old police station on Chestnut Street. And like so many other issues, the pandemic is further complicating things.
It's a very complex issue. It's been around for many, many years, but certainly has been exacerbated as a result of COVID-19.
The new job will be a director-level position working out of the Emergency Operations Center, streamlining the city's approach to helping the homeless community. All of this made possible with federal funding specifically dedicated to the issue.
The main goal of this person would be to collaborate and communicate and work with the number of different entities who are dealing with homelessness.
In a statement to WMUR, Families in Transition New Horizons saying we look forward to learning more about this position and continuing our ongoing work with the City of Manchester in our collaborative response to the homelessness issue. Now, if the proposal makes it through committee tomorrow night, it will then go to the board for a full vote sometime later this month. In Manchester, I'm Nicole Lally, WMUR News 9.
Okay, and there you go on that video and that report. And thank you for joining us for this morning edition of the Riley King Newscast right here on the Riley King Network. I hope you all have a great rest of your day, and I'll see you back here later on today for another newscast. I'll have news report coming up in a little bit. Goodbye, everyone.